Just a few more comments on why cost containment is hard, especially when it comes to new technology. I'm sounding like Yogi Berra probably a little bit, but based on some things that I've been worrying about lately. One has to do with the role of patents. So one thing to say is, well, why don't we think of redirecting innovation toward things that actually reduce costs? The kind of best case would be a cost offset. Invent a new device, invent a new drug, that whatever it costs to discover has the property of reducing hospitalization rates. That's where the money's going. If we were lucky, maybe the real resources that went into discovering it are small relative to the cost offset that would be associated with it. Here's the problem, and then I'll get off the stage because I could get in trouble saying this, but the problem is with a patent system, the owner of the technology is going to be able to capture in the price of the product the value of the cost offset. Think of an invention like some of the things Pete Grunewald from Penn has been looking at for people with coronary artery disease that, say, may reduce the rate of hospital readmissions for people with heart attacks. The hospital would be willing to pay, and the patent holder ought to charge, if there's a greedy profit-maximizing capitalist like we imagine in the Wharton School, a price that would more or less capture all of the avoided penalty to the hospital from from reducing the rate of readmissions. Hope that's not too many negatives in one sentence. At least during the period of patent protection, don't get me wrong, it's not a bad idea to invent this thing. It's not a bad idea to spread it around. There is consumer surplus that will be generated, but in terms of lowering the rate of, and it will actually lower the rate of growth of real resource cost, it just may not lower the real rate of growth of spending because of the patent reward. In some long-term sense, we want those rewards, but in the short run, it may be controversial, and I guess the punchline here is we may want to think about patent policy. My last comment, and then I'll sit down, is to think of the fact that the technology is beneficial. Hall and Jones have shown that when and if we get back to a growing rate of real income in the United States, people will want to spend more of their incremental real income on extending the quantity and quality of life. After all, GDP shares have to add up to 100%. If you don't spend it on health care, you're going to spend it on plasma TV or something like that. And is that more socially meritorious? Not obviously. Eventually, of course, there will be some constraints, but there may be an issue there. But the main issues, I think, arise not in a way for middle-class people under age 65 choosing how to spend their increment in income on better health care for themselves and their family. If that's what they want to do with their money, God bless them. The problems arise for two other groups. One is Medicare. Medicare has greater problems than in raising money than individuals do. I can reach into my wallet and pull out money to pay for additional health care for myself and my family. Medicare has to levy taxes to do it. Economists believe taxes cause distortions in economic behavior, and there are not necessarily limits, but there are certainly increasing marginal costs of raising the tax burden. So even if it would be rational to choose to run more new technology through the Medicare system, it's going to get more and more costly, and so we have to rethink that. And then the other part of the population we need to worry about are people who are not upper middle class. Essentially what's happening, I think, is that the new technology is pricing health insurance out of the reach of the lower middle class. The obvious thing to say, but the hard thing to say is, well, maybe access to technology should be differentiated by income. But don't quote me as saying that. There needs to be some more serious discussion, I guess, of how we really do want to look at the way we're going to finance and make available access to new technology for all Americans. Thank you.